Hello and welcome to this Radiopaedia tutorial. Today we'll be showing you how to upload a case to the website. The first thing you'll need to do is enter your username and password to log into the site. Once you've successfully logged in, click the button marked Add Case. Before you enter anything, take a moment to be sure that the information you intend to input doesn't contain any copyrighted material or confidential patient information. Begin by giving the case a title. Typically, this will simply be the diagnosis. In this case, pulmonary arterial hypertension. Next, you'll need to choose the relevant system. In this case, we will select chest. At the top of the next page, we have a scale to reflect how certain the diagnosis is. The scale ranges from possible to certain. If you select certain, be sure the diagnosis has been proven beyond a reasonable doubt, and the evidence is strong enough that any third party would agree with your conclusion. For this case, we'll select almost certain. You have the option here to choose if this case is suitable for quiz mode. Ask yourself, will this case be useful if presented with the answers hidden in the context of a self-learning session? In this case, we'll choose yes. Clicking Patient's Presentation below will open a text box for you to fill in the relevant information. To the right of that, you can enter the patient's data. Again, we want to avoid using specifics, so please round the patient's age to the nearest 5 years. Now we can create a study by uploading a series of images from one modality. You want to be very careful not to include things like names, hospital ID numbers, specific details like date of birth, or anything else that could breach patient confidentiality. Select the modality from the drop-down menu to begin. In our case, we're selecting chest X-ray. Now, click Choose File and navigate to the folder on your computer where the relevant images are stored. Once you've selected an image, you can repeat the process until you've uploaded all of your desired images. You don't need to wait for one to upload before selecting another. You can easily click and drag the images to put them in the correct order. From the drop-down menu below the image, select the appropriate projection, which in this case is frontal. Clicking Findings below will open another text box in which you can enter your findings. This information is similar to what you would include in a radiology report. This is a good time to double-check your X-rays thoroughly, just to be sure you're not missing anything. To add an additional study, click and drag Additional Study to the dotted line. In this study, we're going to upload a CT scan. This time, we'll try uploading some image stacks, rather than individual images. This can be done by uploading a zip file full of the images you wish to include in the stack. If you haven't already, create a zip file for each stack you wish to upload. This can be done by selecting the images or their containing folder, right-click, and selecting Compress on Mac or Send to Compressed Folder on PC. You can use other software for creating zips if you have it installed. Be sure your images are in alphanumerical order so that they will appear in the correct order when you upload them. As before, click Choose File and select the zip files one by one. They'll take slightly longer to upload because the zips are much bigger files. Again, add your findings in the text box below. Once the stack is uploaded, you can hover over and scroll through the images, just as you would in a real hospital. Select one image from each stack to be that stack's key. This is the image that best represents the whole case. It will be used as a thumbnail. Be sure to do this yourself, or the middle image in the stack will be selected by default. After selecting the key, the thumbnail for the series will be updated to reflect your choice. Again, select the projection below. While the stacks load, you can add a case discussion in the text box below. Here, you want to discuss the specifics of the case itself rather than the general condition. And this would also be a good place to add if and how the diagnosis was confirmed, including adding relevant pathology reports. Always make sure you remove all identifiable information. General information about the condition should go into the corresponding Radiopaedia article. Create links to appropriate Radiopaedia articles in the description. If you want to add links to additional articles, you can do that by adding articles to the Related Articles section. All links that are created in the case will be automatically included in this section once the page is saved. You can save the case as a draft if you wish to come back and complete it later. Or, if you've finished, you can complete the case by clicking Save and Publish. That will bring you to your completed case. If this is one of your first few cases, the case will not be publicly visible until it has been reviewed by our editors. This will typically happen within a day or two at most. The case can be viewed in full screen or presentation mode. Here you can use the case as the aforementioned quiz tool, with the findings hidden for the purpose of study. All of the information and images will now be viewable, along with a link to other relevant articles on Radiopaedia. We hope this tutorial has been adequately thorough and helpful, and that now you'll be able to easily upload new cases to Radiopaedia. Thanks for watching.